Welcome to the latest edition of Women's Health Updates, covering breakthroughs in the past 2 weeks. Brought to you by Lucid Quest. Kallyope's Phase 2b study shows Elismetrep to be a promising candidate for treating acute migraines. This TRPM8 antagonist demonstrated significant effectiveness in pain relief, pain freedom, and freedom from migraine-associated symptoms. Data from the study suggests that Elismetrep could be a potential new treatment option for patients with unsatisfactory outcomes from current medications. The drug is expected to enter registrational studies in mid-2026. In other news, CervoMed's Neflamapimod has shown promise in treating dementia with Lewy bodies. In a Phase 2b study, Neflamapimod demonstrated significant improvements in clinical measures, including a reduction in key neurodegeneration biomarkers. The drug's ability to slow disease progression, particularly in patients without Alzheimer's co-pathology, brings hope for a new treatment for this rapidly progressing condition, for which there are currently limited effective options. Bristol Myers Squibb has delayed the release of data from its ADEPT-2 clinical trial of Cobenfy for Alzheimer's psychosis due to trial irregularities at a few study sites. The data readout, which was initially expected sooner, is now expected by the end of 2026. This delay may impact key regulatory and market timelines for Cobenfy, a drug that could play a crucial role in Alzheimer's psychosis treatment. A recent study has found that endometriosis patients face a 42% higher risk of self-harm, overdose, or suicide compared to matched controls, particularly among those with minimal or no prior mental health support. This underscores the importance of addressing mental health needs alongside the medical treatment of endometriosis. Mental health support should be integrated into the care of endometriosis patients to improve overall outcomes and well-being. A systematic review of 127 studies revealed that endometriosis is more prevalent than adenomyosis, affecting 5% of the general population, compared to 1% for adenomyosis. This review also identified fertility issues as a common concern among patients with both conditions. Improved awareness and diagnostic methods are essential for timely interventions and better management of endometriosis and adenomyosis. The American Cancer Society has updated its cervical cancer screening guidelines, introducing self-collection of HPV samples as an option and providing guidance on when individuals can safely exit screening. These changes are aimed at increasing access and compliance with screening, particularly in underserved populations. By expanding access to HPV testing, earlier detection and prevention of cervical cancer may be possible. BioNxt Solutions is advancing a melt-in-your-mouth formulation of cladribine, designed to offer an easier treatment option for MS patients with swallowing difficulties or dysphagia. This new formulation dissolves rapidly under the tongue, eliminating the need to swallow pills, which can be a barrier to adherence for many MS patients. This could improve treatment adherence and overall quality of life for patients struggling with dysphagia. In global news, Lenacapavir has been approved in Zambia and Zimbabwe for HIV prevention through the WHO collaborative registration procedure. This rapid approval marks a significant step forward in expanding long-acting HIV prevention options in Africa. The availability of Lenacapavir could significantly enhance HIV prevention efforts in sub-Saharan Africa, a region severely affected by the HIV/AIDS epidemic. Finally, Johnson & Johnson has partnered with actress Naomi Watts to promote eye health for women over 40. Their campaign emphasizes the importance of annual eye exams to detect conditions such as presbyopia and cataracts, encouraging women to prioritize their eye health as part of their overall wellness routine. This initiative aims to improve early disease detection and quality of life for women. Stay ahead in women's health research, like, share, and subscribe for our updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.